SE Health is a national nonprofit with over 115 years of experience and 8,000 team members across the country. We provide services across the healthcare continuum, are committed to impact how people live and age at home, and ultimately, our purpose is to bring hope and happiness.
We're deeply committed to culturally relevant, community-centered care, and we work alongside communities to co-design services that align with their values, needs, and priorities. Hi, my name is Corey McKenzie. I'm a father, I'm a husband, and I'm a nurse, and I work with SE Health. Currently, I'm the director of the First Nations Inuit and Métis program.
My name is Brent Glasgow Brown, Regional Director and Business Development Lead.
My name is Colleen Saunders. I've been a manager with St. Elizabeth since March of 2014.
My name is Sarah Kahn, and my role at SE Health is Accreditation Support Specialist. I've been at SE Health for just under 2 years supporting various quality and safety initiatives, the most prominent of those being accreditation preparedness for our seniors living portfolio.
When done well, accreditation helps organizations build confidence in their services, strengthen communication, and most importantly, improve outcomes for the people they serve.
Creating partnerships is integral to growth in any sector. But in the rapidly changing arena of persons' care, this alliance will ensure that St. Elizabeth continues to fulfill our vision of bringing hope and happiness.
Moving through an Accreditation Canada survey, though it requires a meaningful amount of time and attention, in the end enhances resident and staff outcomes with respect to quality and safety. Understanding and complying to the standards themselves, whether it's related to infection prevention, healthy work life of staff, or the physical environment, all of that promotes continuous quality improvement and enables us to better deliver resident centricity and clinical excellence in our services.
For us, Accreditation Canada's guidance has been key in helping teams move from uncertainty to confidence in their accreditation journey.
The accreditation process really sets a strong foundation to quality care, beyond the specific standards by setting a strong foundation for continuous quality improvement.
In our community, accreditation has been instrumental in empowering staff with new knowledge, driven by our quality improvement plan.
Accreditation has helped these organizations and us feel more prepared, more confident, and more in control of their quality journey. One of the biggest challenges that I see in my role is that many organizations, especially those in community and community-based organizations, are working with limited staffing and funding. Accreditation can sometimes feel overwhelming when already managing day-to-day operations. Accreditation brings enhanced communication, clearer policies, and more engaged teams. We've seen teams gain confidence in their roles, and role clarity, improved communication, and overall enhanced service quality.
Renewed confidence and curiosity in the team.
Accreditation has directly contributed to better emergency and preparedness through comprehensive risk assessment, more consistent high-quality care delivery, stronger leadership and decision-making supports.
The improved restructuring of client documentation in the 2 group homes has ensured that all staff, those that have been there for many years, and new staff onboarding, can easily access client care information without having to spend copious quantities of time trying to find the information to help support providing that care to our clients.
Understand governance. Stand up a cross-functional team with leads that align to each standard. Then establish a framework that outlines how that team is going to work together, the scope of those involved, and a clear project implementation plan to ensure readiness in relation to the applicable timelines. Embedding those new activities and key performance indicators in quality improvement plans coupled with consistent monthly and quarterly performance monitoring meetings.
Start with your survey date and work backwards. Be generous with the time you give yourself for each step. Hiccups are inevitable, and this will ensure that you have enough time to complete any quality improvement activities that you've identified. If along the way you identify areas of opportunity that go above and beyond the standards, don't hesitate to leverage the momentum of all the great work you're already doing to push that quality and safety forward.
Focus on sustainability. Make sure your improvements last beyond accreditation.
Embrace your team. Listen. Reflect. Adapt. And demonstrate.
Remember the importance of communicating with your direct care providers and including them in the compliance process wherever possible. Your staff are at the point of care. Their experience at work and their part in ensuring quality and safety cannot be overstated. Scheduling and facilitating a mock survey was vital to SE Health's success. Work with your contacts at Accreditation Canada. They're incredibly helpful in understanding the process, interpreting the standards, getting a good handle on what evidence actually looks like, and preparing for the logistics of the survey itself.
Have fun through the process. It's a lot of work, but there are many benefits of the accreditation process. Obviously, first and foremost, you improve care delivery for your clients, but also the work life of your colleagues.
Seek mentorship and learning opportunities. I would recommend connecting with other community-based organizations to understand what to expect and the strengths that accreditation can help build.
Every day I arrived at my desk and stepped up to a mountain. It was not only overwhelmingly large, but whose peak appeared unreachable. Try keeping a list of everything you've gotten done in a day. It's important to take a moment to reflect